Welcome to another daily briefing. Today's date is May 16th. I am your host, Raymond Montour. On today's show, we have Task Force member Arnold Lazare.
Good afternoon on this beautiful day. Today, rather than give new information, what I'd like to do is to focus on review and look at some of the questions that we've been receiving. The task force seriously takes into consideration all of the questions. I'm going to begin by saying that as people look at it, we acknowledge that there are perceived inconsistencies. Someone would say, why can I do this? Whereas someone else will say, why can't I do that? The task force has a very difficult situation, or in a very difficult situation, where we're actually trying to split hairs. We know that if we move to open the gates too much, we're going to get a flood. And with that flood, we're going to get much more numbers. And with the much more numbers, there's very serious consequences. So the task force has been moving in very small incremental steps. We talk about balance, always trying to balance the safety of the community against the frustration that people are living each day. The first item is the June 1st reopening date that's been tentatively selected. Part of the comments that we get, we used the analogy of driving a bus a few weeks ago, where half the people want us to go faster and half want us to go slower. We've received quite a number of requests saying June 1st is too soon, we don't want you to open, we're doing okay, keep the same pattern. And then on the other hand, we have people saying, I need June 1st to come sooner because I'm having trouble. And we're always trying to find a balance between the economic and the health. The task force has made it very clear that we're going to be looking at health, especially of the vulnerable people, the elders and those that have conditions behind. So just a reminder that June 1st is coming, but that is a tentative date. We can't stress enough that it's a tentative date. In the meantime, people can prepare. The information's been available on the website. It's www.covid-19.kmhc.ca/for business. So if you take a look at that website, that will give a very clear outline of what is going to be required if and when that June 1st date is accepted. Another question we had was, my partner is an iron worker, and if he comes back on the weekend, is he required to self-isolate for the weekend? The answer is yes. We talked about the inconsistencies at the beginning. If someone comes from outside the country and they come to the community, they have to self-isolate for 14 days. It's a very difficult process, but it's very necessary. That strength, or that following that procedure, has enabled the community to remain safe. The person pointed out that our men have been doing ironwork for many years, and it's understandable, but we have never had the pandemic COVID virus before. Unfortunately, or in order to protect the community, if someone returns, they have to self-isolate for 14 days. In a previous episode, we mentioned, would it be worthwhile for them to come back? And ultimately, the decision is theirs. That 14-day item is there to protect the community. New York is still a hot spot, and there was a lot of good items raised, good points raised. But for the next short term, until the restrictions are lifted, people have to self-isolate if they return outside the province. So a question was raised. Don Montour Lazare talked about having a plan in case people get tested positive. A single mother with 2 children, a 10-year-old and a 3-year-old, asked what should she do if she had tested positive. She had suggested stay with her with the grandparents. Once again, that's a very complicated question, but the items that need to take into consideration is that if the mother is positive, there's a good chance that the 2 children are positive, and depending on the age of the grandparents, they possibly could make more of a risk to the grandparents. So in one case, it would be better for the children to stay with the mother. But that then goes to the next question of the mother then should plan on who would take care of the family, who would go out and get the groceries or provide the meals. And then in the worst case scenario, what would happen to the children if the mother had to be hospitalized? So we're asking people to start thinking about those scenarios now so that they have plans in the worst case scenario. In emergency planning, we always say we plan for the worst and we hope for the best. This is one of those scenarios where people would really need to understand and say, our family has a plan, be it best friends, there's very different options. Now, this is not medically, I'm not a doctor, I used to be an EMT, but if people have more specific questions, of course we would always have them directed to the KMHC. But this was used to point out the necessity to do planning. And once again, plan on very bad conditions. I need to remind people that in the Spanish flu many years ago, the first wave was pretty bad, but the second wave was what did most of the damage. There were at least 10 times the number of deaths. Now, Kahnawake has been very good at fighting off the first wave. The Montreal area is still averaging 100 deaths a day. So we've been very good at staying off the first wave. We definitely don't want to be caught up in a second wave. But unfortunately, we know as the decision is made to open up, people will be getting sick. The numbers are going to increase. And the other item that we know is the new normal is not going to be what we thought. When we first started 8 weeks ago, we were planning on a month. Now we're 8 weeks later, going on 9 weeks. The openings, June 1st, is going to be 10 weeks. So all it tells us is we really don't know about what's happening. In terms of testing, people said, why is everybody not being tested? In a layman's terms, what happened was we had, if I went for a test and I don't have any symptoms, I'm going to be negative. If I go for a test too early, I'm going to be negative. So a test doesn't say that we're safe. All it says is that we don't have the bodies in it. So by going for too many testing, we'd get false negatives, and that would create another false sense of security. That's why they're waiting for people to show signs, and this way we can get a better number. So there is a rationale to not testing people without symptoms. It doesn't say that the test would only tell you if it sees that you're positive. So it could lead to a false negative. The task force is on duty every day of the week. The next meeting is Tuesday, but we hope you have a good weekend. Please enjoy yourselves in a safe way. Keep up the good work, Kahnawake.
Thanks for that, Arnold. I just want to make note that the regulation mentioned, although we specifically mention iron workers, it also applies to anyone who crosses the border provincially or federally. Up next, we have a special PSA by Zoze.
And I got one thing to ask you. You wanna go? You wanna go? You wanna go? If you wanna go, then let's go then. Go then. My patented technique to make sure you stay safe while in quarantine during this pandemic. Let me break it down for you. S for stay. Stay inside. If you feel sick, that's the only way we're gonna stop this from spreading further. K for keeping commonly touched areas clean and disinfected. That means your doorknobs, your countertops, etc. Also, keep your hands nice and washed. Oh! For obey public health advice and social distancing. I get my advice from the Kahnawake 911 Facebook page, and I totally didn't get paid to say that. And also, when you are obeying social distancing, it's good to remind others to do the same. Hi, Zoze. Keep your distance, you.
Hey, Zoze, can I borrow your VCR?
2 meters away. D for do not touch your face. E for emergency. If you find yourself in an emergency, be sure to call the Kahnawake Peacekeepers at 450-632-6505. They paid me to say that. And last but not least, N for nose and mouth etiquette. If you must cough or sneeze and you don't have a tissue around, do it into your elbow. Not here like this, in here. So, let's go then. S for stay inside if you don't feel good. K for keeping commonly used areas clean and disinfected. That also means keeping your hands nice and washed. O for obeying public safety advice and social distancing. D for do not touch your face. E for emergency situations, call the Kahnawake Peacekeepers. N, nose and mouth etiquette. So Kahnawake, do your part. Let's go and stop the spread of COVID-19. Stay safe, stay smart. Uno.
Thanks for that, Jose. Remember, follow the principles of Skoden. We had a question come in about the regulations about crossing borders provincially and federally. Asking, what about Ottawa and Ontario? Ontario is a different province than Quebec, so once you cross that border between Quebec and Ontario, you're considered to have to follow that regulation of self-isolation. So just for people to keep that in mind. So thank you. That's for tuning in today. That's our show that's our update for today. Tune in tomorrow to catch Dr. Gauthier. And stay safe, Kahnawake.